Hi, I'm Peter Llewellyn from NetworkPharma TV. This is one of my so-called unscripted conversations, as I like to call it, where I get to chat with folks who I think have something useful to share with us. So let's see what we learned today. And I'm joined by Paul and Faisal. Thanks very much for joining me, guys. You just published your book. I'm going to read it out to get the title correct: Prescription for Success: Delivering Exceptional Customer Experience in the Pharmaceutical Industry, available across Amazon. And basically, you're aiming to show how we should be implementing, I guess, CX, customer experience, good customer experience, to everyone's benefit. I'd like to just explore that topic with you. I think it's interesting. I'm hoping we can explore some interesting aspects to that. And I'd like to start with some introductions. So, Faisal, I'm going to ask you to introduce yourself first, just in your own words. Just tell us who you are and where you've got to where you are, sort of thing.
Yeah, I'm Faisal Ahmed. I'm the digital lead at Alexion. So I've probably been at Alexion for 4 years, but in pharma marketing for, God, 10 years now. So yeah, that's me. So, but all views here are mine, not Alexion's, etc.
Of course, of course. But just give us a little bit of a flavour of what you were doing prior to that 10 years time and what you focused on.
Yeah, a bit of to be honest, various industries. So started off at Amazon when we were a startup. Worked in football for a few years, launching all the digital media assets for football. Worked in computer games, worked in films, books, etc.
Excellent. Okay, so broad experience there, particularly across the digital landscape, as it were. And Paul, tell us who you are, how you got to where you've got to.
Gosh, I've worn many hats. So, a failed scientist to begin with, PhD in anti-cancer drug design. That was the late 90s. Didn't want to stay in academia. And my kind of passion for communication started with my commercial career, which was 25 years ago. Makes me feel really old. Always worked in different forms of agency and consultancy. So, for example, started my career with Data Monitor, IMS, now IQVIA. Probably most well known for in 2009 setting up the Pharma Forum publication, which became a hybrid publication and content agency because a lot of pharma companies were starting to do multimedia. All of that led to us being acquired by Healthware Group, my friend Roberto Ascioni. That was in 2020, a few months into COVID. Stayed there for a few years, stepped away about a year ago to get back to startup land. And I'm doing a bit of my own consulting and also trying to get an AI company in the content space moving as a startup. So a lot on my plate at the moment.
Excellent. Okay. All right. Okay. And the book, which we've mentioned. So let's just start with the obvious question: why the book, Paul?
Well, I could say the easy answer is because Faisal nudged me and said we need to do another book. And I'll let you say a bit more about that. But actually, it does speak to a lot of what I believe in and what I've done throughout my career is we have this wonderful propensity in pharma, which is full of amazing people, to overcomplicate things and get stuck inside our kind of big pharma companies. And so the book is very much about saying, look, stop, look outside. We all do this because we believe in the power of what we do for patients, for doctors, for health systems. But actually, we don't need to overcomplicate understanding what they need. There's a lot of, strategic ivory tower thinking about customer experience, but it comes down to doing some very simple things where you can understand what is needed, act on that, and build products and services that actually work. And that's what the book's trying to do. It's just really simplify things.
Let's cover off. You said write another book, author another book. Just why not give a plug for what you've done before? What previous book was it?
Yeah, well, this was my first collaboration with Faisal many years ago. I think it was really 2012, 13, Faisal, something like that. So Digital Unlocked, this was back in the times when you think about then, digital was very much in the early days. And at that point, every pharma company was going, we need to be on Twitter, we need to be on social media, we need to be doing this, we need to be doing that. And again, there was a lot of over complexity with this. And so that first book, which I think you can still get on Amazon, go and check it out, Digital Pharma Unlocked. It's just about some of the basics of digital engagement. How do you very simply do social media? How do you do, those kind of online channels?
Excellent. Okay, so again, it's all reinforcing the fact that you guys have got quite a lot of background in thinking about digital engagement with the customers and so on. Faisal, cue you, if you're the one that prompted Paul, what was your thinking then? Why the book?
Yeah, I mean, we sort of started it probably over 2 years ago, but wanting basically wanting to do it for years now. And everyone's talking about CX, what is customer experience, etc. And it all goes down to HCPs and let's deal with HCPs and let's do omnichannel, which isn't CX at the heart of CX, proper customer experience. So it's come from learning, working in a shop from the age of 6, dealing with customers, first full-time job at Amazon, which is all about thinking about the customer and working backwards. And that's what this book's all about. It's just thinking about the stakeholder, could be a patient, could be an HCP, could be someone in supply chain. I mean, it could be anyone, and then improving that experience as we go along.
Okay, and it's easy talked about. Sorry, Paul. It's easy to talk about, isn't it? My thing is I've been in pharma for a long time, and we always talk about the customer. And lots of people I know in other businesses talk about the customer.
Yeah.
It's just that's where most people go wrong in not thinking about the customer and not asking the basic questions. Sorry, I interrupted you, Paul. Sorry, I was just going to finish my thought there.
I was just going to say that actually, one of the things I've always loved about working with Faisal is that he's not spent his whole career in pharma. He's had this career before pharma, places like Amazon. And I know we love to think we're special and we're different in pharma. And yes, we are regulated, all that kind of stuff. But there's so much that you can learn from these other industries. And I've always learned from Faisal, from his experience, that we can bring across to pharma. And the other bit that he kind of triggered a thought on was, one of my bugbears is all of the language in pharma is about channels. We have multi-channel, omni-channel. I think it's now opti-channel. And that means all the focus is on the channel. And there's a lot more to it.
And just, I'd like to ask 2 quick questions. One is just clarification, because I think Faisal there, you threw in CX and UX. Customer experience, user experience, without getting too far down this, because I think the terminology around this is all a bit confused. But let's just cover that one off. You mentioned CX and UX. Just give us a bit of clarification on how you distinguish between the two.
Well, user experience is obviously a digital term. Customer experience is a general term, right? So user experience is how people interact, usually with your product or your website, where customer experience is that whole holistic approach. So how people walk into an Apple shop, how that whole experience is from scratch to purchasing and carrying on with, like, they've got the Genius Labs, they've got various other activities going on. That's customer experience.
Okay, so UX is a bit of CX.
Yeah.
Okay. And the other thing that I wanted to explore a little bit was just who is the customer. I mean, as I sort of say, I've spent a long time in pharma always talking about the customer, but the confusion has always been around who is the customer. I know to some extent you sort of gloss over this in the book terms, because what you talk about is all customers.
Yes.
But I would just like to explore a little bit what you think the industry tends to mean when it's talking about customer, and what confusions can arise within that. Paul, do you want to just take that for a moment?
Yeah, it's a great question. So I think the industry, when you talk about the customer, most people would think about the healthcare professional who's doing the prescribing. But to your point, we know it's more complex than that. There is, of course, the patient who's the ultimate end customer. You've got payers, you've got policymakers, you've got regulators, et cetera, et cetera, et cetera. So within the book, we do tend to talk about HCPs and patients, but the principles and everything that we outline can apply to any of those customers. Now, the challenge, of course, is, and this is a conversation I have a lot with people in pharma, is every customer wants something slightly different. So you often hear in pharma, it's all about the patient, and that's great. Kind of that should be the mantra. But actually what the patient wants might be different to what the doctor wants, which might be different to the regulator, et cetera. So there is this extra level where you're trying to bridge those different experiences and find what's the kind of route that will kind of please everybody to some degree.
Faisal, any comment on that?
Yeah, I think we do. That's the problem. That's why we try to write this book and just do a really nice sort of easy process. Is when you say customer experience, they think HCP straight away, right? Where we're trying to push it and change it a bit where it's everyone. So, for example, if you have a customer experience, say you've got HCP experience, the commercial department say, right, we need to work with the customer, have that experience. The medical department are doing something totally different with the same customer. So it's right, let's combine it, let's have one person, and let's have a proper experience across every touch point we have with the customer. And then it flows into, like, the suppliers you work with, that's the whole customer experience. How do you improve that experience when you go into patient groups, etc., and go into conferences and congress, that whole experience as well. That's why we're trying to reinvent it a little bit. Does that make
I
sense?
mean,
Yeah.
it does. I mean, I just wonder from where you're sitting, do you see the industry actually embracing this idea? And Paul, you already talked about the fact it's very channel sort of driven and so on. I mean, are you fighting against closed doors? Are you seeing an industry that is changing or not? I mean, what do you see from where you're sitting, Paul?
I mean, I'm an optimist. I'm the eternal optimist. I do see an industry that's changing. And of course, we talk about the pharma industry. It's lots and lots of very different companies. So some, let's be honest, are a little bit behind on customer experience and get lost inside their own sort of companies. Others are very forward thinking. But I do think there's a general shift towards understanding that, you look at the way the healthcare system's set up now, you look at the impact digital has had on the healthcare system, you look at the way we're shifting towards outcomes rather than just providing product. That means most pharma companies are having to think not just about delivering good medicines, but also what else is going on around those that will impact the uptake of those medicines or the adherence of those medicines. I think it's forcing some of that broader customer-centric thinking.
But who owns that within the pharma company?
Everyone should own it. Everyone should own it. So you don't walk into Amazon or any other company that's really good at CX and you have a CX person in the corner who just does CX. Everyone owns CX.
Yeah,
but obviously, what's behind my question is: do you see that happening within pharma companies typically? Because it's so siloed so often, in my experience anyway. But
there's pockets of it happening. There's senior leadership which are really pushing it as well, and it just takes time to sort of calm down, etc. as well. What we don't want to say, and this is all over LinkedIn at congresses as well, is that CX has been classed as omnichannel. Omnichannel isn't CX. CX is everyone's point. I mean, we always Amazon do this, and I always say, I've said this within every meeting as well, is that you have an empty chair in the office, in the meeting room, and that is the customer. So if you're discussing a patient campaign, that empty seat is the patient, and you think about what the patient needs is, and then work backwards.
I think we do have this complexity, though, don't we, in pharma, that we have all these different almost silos and groups. I mean, the most obvious ones being medical and commercial. So if you start to think about who owns that, you get into these debates about, well, should medical be part of commercial? And some pharma companies are going in that way. Should it be separate? But I think to Faisal's point, we know all of that's going on. You're not going to change those silos overnight. And in some cases, maybe you shouldn't. But I think the point is getting those groups talking, them all understanding what their role is in engaging with the customer, whether it's doctors, patients, whatever, but really then kind of deeply understanding what does that customer experience look like, not just within their silo, but across the whole picture, driving that kind of collaboration. Then you can start to do some interesting stuff.
What we keep mentioning omnichannel. I mean, we can have a whole discussion, I guess, about omnichannel. And Paul, you mentioned optichannel, which seems to be a word that people are starting to use. I mean, I've never really understood what the heck they're all talking about, or what happens in practice around that. But just out of interest, what is optichannel, Paul, as you understand it? Because I might as well ask somebody, because I'm seeing
it's the latest buzzword that somebody's come up with because omnichannel has got too old. And I get a bit frustrated with these terms, because ultimately what it should all be about is a connected experience. Now, that's very different to certainly where some companies still are, and where a lot have been in the past, which is we've now got 20 channels that we can just hit the customer with as much as we can through those. We all live in an age where you want a connected journey and a connected experience. We all live in an age where our attention spans are terrible. So we don't have the duration of attention, sadly, that we used to have 20 or 30 years ago. And that means for all these companies, you are walking the customer on a journey one piece at a time. That is what, whatever you call it, omnichannel, optichannel, that's what it should be about, is understanding for each individual customer where they are, what the next bit of the story is they need to hear, when they need to hear that, through what, I mean, the classic stuff of right customer, right channel, right time. but it often falls into the trap of being, well, let's just use all these channels and hit people with as much as we can. But it's about those connected customer journeys.
To define it, Peter, one of the first chapters, the early chapters in the book, is all about internal culture and how to change that mindset a little bit. Even includes like a questionnaire you can send to people to see where you are on that customer experience.
Okay, so I guess one of the things you emphasize certainly up front in the book is this is about practical experiences, practical guidance, and so on. So perhaps we can just talk a little bit about that. I mean, Paul, I'm choosing you again, but can you lead the way a little bit? What sort of actual practical guidance do you provide in this book? Can we relate it back to some sort of like practical experience from within the pharma industry? I do know that you share a number of examples of other companies outside of pharma, but what can you share a little bit that's happening within pharma that's addressing the sort of challenges that you're talking about?
What's your point? I mean, pharma companies are doing some of this. So the book is structured around the 4 fundamental stages of research, understanding your customer, analysis, then stepping back and looking at that different techniques for kind of understanding what that's telling you. Design, where you are designing the experience. That might be a digital product. It might be a much broader experience. And then that launch, learning, and scale. Now, every company to some degree is doing something in each of those stages, but maybe not in the right way and maybe not with the right techniques. You'll see in each of those chapters, they're very simple, even like workshop templates for how do you do design, for example? How do you do things like empathy mapping when you look at the customer journey? How do you do product design? And that's what the book is designed to do. It's not saying you have to do all of these things, but if you want to really understand how to do analysis, research, design, launch, here's some templates you can follow. Here's some techniques that will probably shift you a little bit further forward.
Okay, but is there some experience you can share with that or sort of case histories or some sort of practical results that have come out of that you can share?
We don't talk about individual companies within the book, but these techniques are being used by companies all over the world, not just within pharma. That's Faisal's point, but they're being used by some of the big names. You look at what Amazon does, Google does, those kind of companies. They've deployed these techniques really effectively, and you couldn't really argue they haven't been successful.
And we've got, Peter, we've got little examples like with Gov UK and what NHS does in the book as well. So a little example of Gov UK, the website is so simple to use. Some people hate it. A lot of people like it. It's won loads of awards and stuff. But there's little things down to how the font is on the website. So, for example, the font they'd taken was the font that you see on motorway signs, because you can read it really clearly. You can see it from a distance. So they actually converted that font for web usage as well. That's customer experience, right? That's little things like that really improve. And there's stories like, I do this all the time when we're launching, say you're launching a website or digital product or an app, etc. When you do the testing, I've got 4 different phones to test on, and they're all based on how many phones are sold most in the UK, etc. And little things is when I test, I go into Starbucks or Costa and test it, not on their Wi-Fi, but on the 4G, 3G or 5G. So you're having that really good experience down to really bad internet connection as well.
I'm talking to Faisal's point. You'll see us talk in the book a lot about when you're applying these techniques, thinking about accessibility for different types of customer, thinking about diversity, thinking about sustainability. These are all important factors. So we don't just see the customer as kind of one homogenous group of people, because it's...
And accessibility is big, right? We're looking at a lot of pharma websites and healthcare websites. They're not really accessible for various people. Do you see what I mean? And I even had an argument with an agency that built a website for us many years ago. And I said, look, we need accessibility on it. And they were like, no, you don't need accessibility. Literally, they said no. And they said to have it on, it will cost another X amount of money. I was like, well, this needs to be baked in right at the beginning. It's like when we first came into pharma, the first thing we did on websites was bring in personas, was bring in the right UX, etc. But more importantly, bring in accessibility for everything. So and it's W3C standard accessibility as well. And now you see companies really push it, right? Microsoft are at the forefront of this, Google at the forefront, Apple at the forefront. making their products accessible for everyone. And it's more important in pharma than it is for Microsoft, because we are dealing with patients as well.
Yeah, I think just to build on that, I think websites is a really good example, because we've all heard the argument around pharma companies shouldn't launch websites, and it often then goes to, well, there's the trust factor and they should use independent websites, and when they do build them, nobody comes to them. And there's all kinds of stats that support the kind of low levels of visits. But then you also look at some of them and go, well, actually, they're not accessible. They're not really engaging. The content's not updated. That's not a good customer experience. And far more than the trust issue, that's why people are not going to those versus other independent websites that are updated more frequently.
Yeah. I mean, there's arguments we can argue into that in all sorts of ways, sort of thing. I mean, I always think personally, pharma company websites may not be the most used, but if I was a pharma company, I would want a website, because some people are going to use it. I mean, it's no more complicated than that to me. And if I have a website, I want it to work properly. It's no more complicated than that. It can be very simple. I don't have to have a flashy, fancy website. But even if it's relatively few people who come and have a look at it, I want them to get what they want. I mean, just sharing an old story, and I should, but when I worked for a very large publishing company at one stage in my career, and they launched their sort of basically, they were selling their books and stuff, and I always remember, I literally didn't think about this. I went home and I bought a little book off that website to see what happened, and it took, this is going back a long time, okay, but even so, I just did it without thinking about it. My own money, I just did it. And 2 weeks later, I got this gigantic package arrive with this silly little book inside it. And I always remember walking in the next day and talking to some of the senior guys and going, have you tried this? This is what's happened. Is this the best way of doing it? And there was actual astonishment that I'd done it. I mean, it was simple astonishment that I even tried to do something off my own back to see what happened, and I was then questioned. And I just think that strikes at a root of a lot of this. People who talk about their websites who've never actually just come in and tried it, or sat next to someone trying it, or any of the other. I mean, we're getting into, this is where I find it interesting, because we're getting into UX rather than the broader CX sort of thing. But it's that sort of, have you tested your own system? Have you run your own office to see what happens? I mean, that was a big one for me a few years ago, when you couldn't get through to anyone in the office because, I don't know, everyone was going virtual or something. It's just, and you talk to directors of the companies, go, have you rung the office and see what happens? Why would I do that? I just ring the person I know, and you just go, you're not getting it, guys. And I think there's a whole thing in there that strikes at how none of this works, or how difficult it is to make this work in practice. Does that make sense?
Yeah. It's all common sense. And CX is common sense, right? We go into a shop, we live our lives on a day-to-day basis, and we come across so many different experiences with so many different brands, etc. And then when we have that bad experience, we tell everyone. When we have a good experience, we tell more people as well. And then it's that, if you have that good experience with an HCP, a patient, or whoever is in the ecosystem, they will tell the next person, go to that website, or that company's done a really good experience. And I've heard that from a doctor as well. We did a webinar many years ago. The whole experience was all about how do we improve the webinar experience. And a year later, we interviewed an HCP, and I was chatting to her, and she mentioned that she told all her colleagues this was a great experience because the tech worked. And she says a lot of the webinars she went to, and this was all during COVID, a lot of the webinars she went to online were really bad tech experiences, and they gave up.
I've heard similar things. I mean, you go back a few years, the COVID years, and the number of pharma companies launching webinars because they couldn't get in front of customers. But of course, rather like we're doing, they'd use channels like Zoom. And then you look at the NHS and you find that most people in the NHS on the NHS IT system can't have access to. And they wonder why people aren't using these things. But I think it's also about, it's an interesting conversation, because it's also about customer experience does evolve over time. And it's not just an age thing, but, people of our generation probably have very different expectations than the younger generation coming through. And I mean, look at things like websites. It's a really good example. Are we going to be going to websites in 5 or 10 years' time? I don't know, because we're probably going to use the AI prompt and say, I'm looking for this. It's going to go out there, grab all the stuff and bring it to us. Does that mean websites aren't important? No, because they're still there to feed that engine, but the way we look at them probably changes. So you have to recognize it's shifting over time. You can't necessarily do even what you were doing 2 or 3 years ago and expect it to work.
And go back to the brands that have good experience rates. Every workshop I've done over the years or talked about CX, people always come back with the same brands that have good experience as well. I'm talking non-pharma brands, right? So it's always Virgin Atlantic. It's always John Lewis is mentioned. Amazon's always mentioned. It's those brands always mentioned in the UK that you have that great experience with, and you can see it. They have the repeat listen.
Okay, look, guys, we've run out of time, so I suppose we should wrap this up. But it's interesting, as you say, a lot of it is just common sense. I think a lot of it's common sense, and if you ask yourself basic questions or test your own systems, it sort of becomes a bit obvious that you can improve things. But it's useful to have some guidance and have people making you think about this stuff, which hopefully these sorts of conversations do, and also the book, which we'll just read out once more: Prescription for Success, Delivering Exceptional Customer Experience in the Pharma Industry. And people can find that on Amazon. But more importantly, I would suggest I can speak for you and they can reach out to you on LinkedIn. I know you're all happy to hear from anyone who wants more information. Yeah. Okay. So I'm going to wrap it up. A quick plug for me, NetworkPharma TV. Come and have a look at what is now hundreds of videos featuring people from across the industry talking about stuff to do with the pharma and biomedical industry. So reach out to me on LinkedIn, come and have a look at NetworkPharma TV and let me know what you think. So guys, thank you so much. Little wave and we'll say goodbye. Cheers. Bye.